Good. And I'm going to turn off my camera. Very good. So Tempida, which is tempida.com, stands for Template-Based Intelligent Documentation Assistant. And it's an AI-assisted software that helps doctors, providers, PAs, nurse practitioners, document clinical visits and surgeries and performs all the clicks and data entry into the EMR system, all of which is very time consuming. We're going to do a video in a minute and you'll see it in action, but it consists of two main components. One is the template or documentation system, which is AI-assisted templating. But there's an easier way to start, which requires virtually no training, and you can start from day one, and that is you can use dictation, just like many physicians have been doing their entire careers, and then let the autopilot, which is a one-button input, put all that information into the EMR, and those 15, sometimes 20, 25 button clicks usually take about a minute. We always say that we can save you at least an hour a day. Of course, that does depend on how many patients that you see. But generally speaking, a busy practitioner can save at least an hour just using autopilot and the dictation. When you get to the point where you are using the smart templating, you can save even more time. Another really important feature of Tempida is that it's browser-based, and it works with any EMR system without any integration. That means there's no HL7 or Fire integration, and usually that type of integration is difficult to get and sometimes expensive, so there's none of that. So you have zero startup time also if you use dictation, because there's really no training. You just dictate normally. It goes into the Tempida program, and then it's automatically entered. If after some degree of use you decide that the AI-based templates can save you more time, then if you happen to be an orthopedic surgeon, we have 250 publicly available templates that can be customized for individual use. Today's presentation was supposed to be made actually by the designer and orthopedic surgeon, Dr. Kishore Tipernini. But Dr. Tipernini, like a lot of orthopedic surgeons, occasionally finds himself on trauma call, and he's actually in the OR right now, scrubbed, doing a trauma case. So I'm standing in for him. Tempida can handle any text-based notes like clinic notes, op reports, consults, hospital progress. So it can not only be used in clinic, but it can be used in surgery or in any other procedure room or critical care area. I mentioned earlier the Tempida autopilot. This is the easiest and coolest part of Tempida. It automatically enters the data, no interface, saves a lot of time. It gives you also cloud storage of all scripts, automated tasks, and it can work on multiple monitors independent of screen resolution or zoom settings. If the video and what you see today is of interest to you and you think you'd like to save time and be more productive, you can email me at mmaloney@venops.com, and my cell phone is 678-895-1159. Now let's double check here, make sure that the screen sharing is still going. It is, good. And I'm going to now start the video. Starting at the beginning.
Welcome to this demonstration of Tempida, which is a new AI-based software that gets rid of the problem of medical documentation and the amount of time it takes physicians to document into their EMR. Tempida is an acronym that stands for Template-Based Intelligent Documentation Assistant. It consists of two components. The first component is called the templater, which runs entirely in a web browser, and this is where your notes are generated. The second component of Tempida is called the autopilot. The autopilot will take the data from the templater and then do all the button clicks and automation and data entry into your existing EMR. It doesn't matter what the EMR is. and really streamlines your efficiency. So when you first start using Tempida, you'll just open up a simple web browser like this, go to the Tempida website like this, and hit the login button to log into your account. And once you log in, you're into the Tempida editor. Typically, when physicians use this, they will be on a dual monitor system with Tempida on one side and their EHR on another. But you can use it on a single monitor system like we're doing now. The problem with existing EMRs is that they may have templating features to make things efficient, but those templates are what I call static templates. They're templates that aren't very intelligent and cannot handle variability. So for example, let's suppose you have a patient with carpal tunnel syndrome, which is a common problem in orthopedics. There's a lot of variability between patients, like how long they've had symptoms, what other treatments they've had, and what my plan is going to be. And because all those variables, it's very hard to use static templates. So most physicians, even to this day, still end up dictating all this information. But Tempida is different. With Tempida, you just open up a template by searching for it. There's 250 publicly available templates already available as soon as you sign up for all the problems in orthopedics. So if you're looking for a particular template like carpal tunnel, you just select that, and then that template opens. The way these templates work is they're AI based. All you have to do is select the variables at the top that could be variable between patients in carpal tunnel, and the AI automatically generates at the bottom the entire note for you. So for example, on a patient, I can select which side they have symptoms on, how long they've had symptoms, some physical exam findings. Let's suppose they brought in some x-rays for me to look at. As I'm making these selections, Tempida's AI is automatically changing the note at the bottom to reflect these changes. Multiple sections of the note can change at once with one button click. So right here under assessment plan, it says that the patient is going to be doing a carpal tunnel. I'm going to be doing surgery on this patient for a carpal tunnel release. Well, let's suppose instead of doing surgery, I just want to get an EMG test. I just select that at the top. That entire block of text changes to reflect that. And in this way, even complex notes like this can be generated in 10 to 15 seconds with Tempida. Now, once the notes are generated, how do they get into your EMR system? That's where the second component of Tempida takes over. It's called the autopilot. It does all the button clicks and data entry into your existing EMR, and it's activated by one key press. So I'm going to go ahead and press that key right now. And everything that you're going to be seeing happening here is not being done by me. It's being done by the AI that's going in and doing recognizing the screen and doing all the button clicks and all the data entry. Typically, when this is happening, I just go on to see the next patient and let the AI handle all the data entry. So right now, it's creating an office visit. A visit summary for this patient. Next, it's going to go ahead and create a new office note for this patient. This happens to be Cerner that it's using, but it can work with any existing EMR. Now, once it's creating this note, it's going to paste in the text we created in the templater and also sign my note. And then now it's finished with the automation. So there is no actual interface to the EMR. The autopilot works visually just like a human scribe would. It can recognize elements on the screen, moves the mouse to where the button is, and then does a mouse click and also the data entry. So it works with any existing EMR without an interface. But when you're first starting out in Tempida and maybe you don't have all your templates set, what is a quick way you can start out? Very quick way you can start out and still get the advantage of all the data entry from the autopilot is just to use a blank template. So for example, I can open up a blank template here, and then I can use voice to text like Dragon to enter the information here. So for example, this is the history on this patient. And then I can go in and do the physical exam. And then I can go in and do the assessment and plan. And then once I'm done with that, I can again use the autopilot to do all the data entry and all that stuff. So I'll just hit the F1 button again, and then it will go in and do all the stuff that we've seen before. So when you're first starting out, you can still continue to dictate before your templates are completely created. And you can still take advantage of the autopilot to do all the button clicks and automation in your EMR. And then even after you create some templates, you can have a hybrid of when, okay, here's a patient that I can use a template that I already have, and here's a patient I'd rather dictate. So it gives you the flexibility to do exactly what you want on a per patient basis. So using these methods, you can completely streamline your practice and significantly reduce your documentation time in your EMR system. Thank you.
Well, thanks very much. That pretty much concludes today's webinar. I want to invite you to shoot me an email at mmaloney@venops if you think that you'd like to do a one-on-one meeting with Dr. Tippernini, who, for those of you that were a little bit late getting, it was actually scrubbed now on a trauma case, or he would have been narrating this personally himself today. He's been using Tempida in his practice for over a year. This is his second year. And in his first year, he increased his productivity, which was quantitatively documented by RVUs, by 30%. And that's a significant increase in efficiency and also revenue production. In his second year, he's actually looking forward to another 25% increase based on his performance in January. So it's phenomenal. Even only starting with autopilot, which I said requires virtually no training or template creation or modification, you can save a tremendous amount of time every day in clinic. So again, thanks very much for attending today, and we'll see you on the next webinar. Take care.